When expanding human infrastructure pushes directly into native habitats, the animals living there don't relocate. They try to navigate the borders we paved over them. This chart tracks the resulting fallout. Vehicle collisions represent the single largest threat at 462 incidents for the year, followed by pet interactions and the destruction of nests and habitats. To manage the thousands of animals caught in this intersection, northwestern Pennsylvania relies on the Tamarack Wildlife Center. As the human footprint expands, local ecosystems are being pushed toward a breaking point, and regional wildlife centers are bearing the brunt of the casualties. Historically, Tamarack's admission numbers have followed a predictable curve. Between 2019 and 2023, the workload remained steady, but in 2024, the baseline shifted. The center admitted a record-breaking 1,720 patients, a 44.5% increase in a single year. Deep within that massive surge was a patient that represented an entirely new challenge for the staff, an orphaned baby porcupine named Thistle. Porcupines are high-risk medical patients. They are covered in approximately 30,000 barbed quills that detach and embed themselves into skin upon the slightest contact. When Thistle arrived, the staff at Tamarack had no prior experience treating or even handling the species. This single patient became a test of the center's ability to adapt, arriving at the exact moment the overall patient load was reaching its highest level in history. The team immediately moved into a research phase, consulting with outside specialists and studying professional veterinary texts to build a care plan from the ground up. They had to develop safe handling procedures on the fly, adopting thick vinyl gloves and protective aprons to prevent quill loss and keep the handlers safe during exams. At the same time, they formulated custom supplemental nutrition and wound care protocols specifically for a growing orphaned porcupette. Saving Thistle required the team to move beyond general volunteer husbandry and implement the kind of research-driven medical protocols found in professional hospitals. This wasn't a freak occurrence. Maturing forests are currently pushing porcupines into new geographic ranges across Pennsylvania, meaning these animals will likely become a permanent fixture at the center. Tamarack had to manage this high-stakes case while simultaneously treating 476 eastern cottontails, 265 Virginia opossums, and hundreds of other standard admissions. That same team was also treating a record 20 bald eagles, using specialized clinical techniques to fight the effects of lead poisoning in the region's apex predators. By managing this level of volume alongside complex raptor and porcupine cases, Tamarack is now functioning as a professional wildlife hospital for the entire region. But even the best medical outcomes have a limit. Rehabilitating a patient treats the injury, but it doesn't address the human behaviors that cause the collision in the first place. To prevent these injuries before they happen, Tamarack expanded its education programs, increasing its total audience reach by 10% this year. They deployed new animal ambassadors to help the public connect with native species, including the recent addition of Sunny the gray rat snake. By using these ambassadors in public programs, the educators can teach the community specific ways to reduce wildlife hazards in their own backyards. This creates a cycle of conservation. Medical care manages the symptoms of human-wildlife conflict, while education works to solve the cause. After 4 months of intensive rehabilitation, the experimental care plan worked. Thistle was released back into her habitat, healthy and able to forage on her own. That research-heavy investment paid off almost immediately. Later in the year, the center admitted 3 more porcupines, and the team was already prepared to treat them. Thistle's release mirrors the ultimate goal for every patient, returning healthy wildlife to the ecosystem where they belong. Successfully documenting these protocols and repeating them with subsequent admissions has effectively added porcupines to the center's permanent range of medical expertise. However, the massive growth in professional capability during 2024 has pushed the center to the limit of its current physical space. To navigate this surge, the board of directors has finalized a new strategic plan to guide the organization's expansion. The core of that plan is securing land and building a new, larger facility designed to handle the region's increasing demand for wildlife care. Expanding their physical footprint is the next step toward realizing their vision, a community where both humans and wildlife have the space to thrive.